we know from our personal experience that the family caregiver crisis and the professional caregiver crisis are two complementary but different things. In the United States, in any given year, there are 50 million Americans who provide care to loved ones, either ill, disabled, or elderly. They provide $375 billion worth of unreimbursed care to the U.S. economy. But this care is not free. Being a caregiver is difficult work, and it takes both a physical and a psychological toll on caregivers. Of family caregivers, 60% of them are employed, and the majority of them work full-time. A recent MetLife study tells us that U.S. business loses $34 billion annually to overtime, to absenteeism, to turnover, and to lost productivity associated with family caregiving. So logically, we might say, well, can't we rely on the professionals to take care of this caregiving? But that doesn't work, because simultaneously we are facing, as a country, a healthcare workforce shortage. Among the 5.2 million professional registered nurses and nursing assistants who care for patients in our healthcare system. This group of people is plagued by dissatisfaction, which fuels high turnover rates. This in turn leads to shortages in our healthcare workforce. And by the year 2015, it is predicted that we will have a 20% vacancy rate in healthcare workforce, which will then further lead to dissatisfaction and fuel this vicious cycle, which equates with costly complications in patients and a loss of productivity among staff. So what do we know about the caregiver crisis? On a macro level, we know for sure that it's big, it's expensive, and it is getting worse. The aging baby boomer population is set to collide with a healthcare system that is starved for financial and human resources. On a micro level, caregivers need help, but we know that they're difficult to reach. This group of people is overworked, they're overextended, they're exhausted, and all too often, they focus on other people's needs and totally forget about themselves.